Teeth Express Immediate Load Conversion Technique. Confirm that the abutment platforms are free of any debris or soft tissue. Place the multi-unit healing caps and hand tighten using the hex driver. Syringe bite registration material into the denture that will be used for the conversion. Place the denture over the multi-unit healing caps and have the patient close into light centric occlusion. Once the bite registration material has set, remove the denture. Use an acrylic burr to create small holes through the denture at each point where an indention was created by the multi-unit healing caps. Place the titanium copings onto the multi-units using the prosthetic screws and a long 050 hex driver. Hand tighten. Try in the modified denture to verify the alignment of the holes in the denture and the position of the titanium copings. If they are in alignment, widen the holes and ensure that the titanium copings pass freely through them. A minimum clearance of 1 mm is recommended on all sides of the titanium coping. Modify the height of the titanium copings to ensure that the patient can bite into occlusion. Place a rubber dam over the titanium copings to protect sutures and to block out undercuts. Place cotton into the titanium coping screw channels and cover them with dental wax to prevent acrylic from entering the channel. Place the denture over the titanium copings and syringe flowable acrylic into the holes and around the titanium copings. Allow the patient to bite into light centric occlusion. Once the acrylic has hardened, remove the dental wax and cotton from the titanium coping screw channels and remove the prosthetic screws. Remove the modified denture and the titanium copings will be picked up within the denture. Add acrylic to any voids around the coping and shorten the posterior cantilever. Remove the denture flange to avoid any contact with the tissue and smooth any rough or sharp surfaces to complete the provisional restoration. Place the provisional restoration and torque the prosthetic screws to 15 Newton-centimeters. Place a resilient temporary material into the screw access channels and fill the remainder of the channels with a composite resin.